Could a natural, private act, something many consider harmless, carry unforeseen implications for your health that you're simply not aware of? We're talking about self-pleasure, or masturbation, in the context of aging. Now, this isn't about judgment or shame. Far from it. This is about bringing crucial health information into the light. Many men continue this practice throughout their lives, perhaps without realizing how the body's changes over time might alter the equation. What felt straightforward in younger years might now deserve a closer look, not because it's wrong, but because understanding it fully is key to maintaining your vitality. Before we delve deeper, I'm curious to hear your initial thoughts. What questions or perhaps even concerns come to mind when considering this topic in relation to aging and health? Please take a moment to share in the comments below. Your perspective is valuable as we explore this together. Why discuss this now? Because ignoring aspects of your sexual health, even the private ones, can potentially lead to misunderstandings or even neglect of your body's signals. As we age, our circulation changes, skin sensitivity shifts, and recovery times might lengthen. These aren't reasons to stop, but they are compelling reasons to be informed. There's a surprising amount of outdated information and lingering stigma surrounding masturbation for older men, leaving many unsure or even feeling unwarranted guilt. This conversation isn't solely about pleasure, it's fundamentally about health awareness and making conscious choices for your well-being. It's about ensuring this natural expression doesn't inadvertently conflict with your body's changing needs. We need to cut through the silence and look at the facts, the potential benefits, and yes, the potential risks that often go unmentioned. Just like with supplements, assumptions about masturbation can be misleading. Let's look at some common beliefs that might actually be doing more harm than good by preventing informed understanding. You might have heard whispers, or perhaps even internalized the idea, that this activity is somehow unbecoming or unnecessary after a certain age. Let me be clear, this notion is entirely unfounded from a biological standpoint. Sexuality doesn't simply vanish with wrinkles or gray hair. However, thinking it remains exactly the same as in your youth, without considering physiological changes, that can be problematic. Ignoring how your body has aged in relation to this act is where the potential oversight lies. This is an old myth, often tied to outdated ideas about life force. Scientifically, there's no evidence that moderate masturbation depletes you long-term. In fact, the opposite can sometimes be true. The release can be invigorating. But here's the crucial distinction. Ignoring your body's signals can lead to fatigue, pushing too hard, too often, or using techniques that cause strain because you haven't adapted to your body's current state. That can certainly leave you feeling drained, not the act itself when done mindfully. It's about balance, not depletion. This belief minimizes the role of self-knowledge and personal health maintenance. Masturbation can be a way to stay connected with your own body, understand its responses, and manage sexual tension, regardless of age or relationship status. It's not necessarily a substitute for partnered intimacy, nor is it solely a symptom of loneliness, though loneliness is a separate, serious issue for many seniors that needs addressing. Reducing it to just these things ignores its potential role in self-awareness and physical upkeep. Assuming it's only about loneliness might cause you to overlook other reasons for fatigue or mood changes. While the act itself is generally safe, this blanket statement misses the nuance. It's not the act, but how it's performed in the context of an aging body that matters. Ignoring skin fragility, joint stiffness, or underlying circulatory issues while engaging in the activity could potentially lead to discomfort or minor injury. The danger isn't inherent in masturbation, it's in the lack of awareness or adaptation. Just like taking too much of a good vitamin can cause harm, an uninformed approach here can have downsides. Now, let's move beyond myths and look at the science, considering both potential upsides and the often overlooked cautions. Some studies suggest a correlation between regular ejaculation and a potentially lower risk of prostate cancer. The theory often involves flushing out the prostate gland. Now, let's be cautious here. This is not a guaranteed prevention strategy or a cure. Think of it more as a potential contributing factor to overall prostate health, alongside regular checkups and a healthy lifestyle. It's one piece of a much larger puzzle, not a magic bullet. Relying on this alone without medical oversight would be unwise. Arousal naturally increases blood flow to the pelvic region. For older men, maintaining good circulation is vital, impacting everything from erectile function to overall cardiovascular health. Regular sexual activity, including self-stimulation, can gently encourage this blood flow. However, this doesn't replace the benefits of proper exercise, diet, and managing conditions like high blood pressure. It's a supplemental effect, not a primary therapy. Orgasm triggers the release of endorphins, natural mood boosters, and pain relievers. In a world where stress can significantly impact health, particularly as we age, think cortisol levels and inflammation, having a natural way to potentially alleviate tension can be beneficial. But again, it's one tool, not a cure for chronic stress, anxiety, or depression, which often require professional support. Now, the cautionary side, risks of uninformed practice. This is where we need to be particularly vigilant, much like understanding the downside of excessive vitamin intake. Overdoing it, using excessive force, or neglecting lubrication can lead to chafing, soreness, skin irritation, or even minor injuries like penile bruising or Peyronie's disease in susceptible individuals. As skin becomes less elastic and perhaps drier with age, the risk increases. Are you listening to your body? Are you being gentle? Ignoring discomfort is a red flag. It's not about endurance. It's about comfortable, safe pleasure. Pushing through pain is counterproductive. If you have arthritis affecting your hands, circulatory issues, or nerve conditions, certain techniques or positions might be uncomfortable or even risky. Masturbation shouldn't cause significant pain. If it does, it might be highlighting an underlying issue that needs medical attention, or you may need to adapt your approach significantly. Don't let embarrassment prevent you from discussing health changes with your doctor. While the act itself isn't inherently harmful, excessive preoccupation, guilt, or shame stemming from societal taboos can negatively impact mental well-being. Furthermore, if it becomes compulsive, interfering with daily life or relationships, it might signal deeper psychological issues that need addressing. Healthy sexuality is integrated, not isolating or all-consuming. So, what should you do instead of just continuing out of habit or stopping out of fear? Adopt an informed, mindful approach. This is paramount. Pay close attention to sensation. Does it feel good? Is there any pain? Does your body feel strained? Slow down. Be present. This isn't a race. Adapting speed, pressure, and technique based on real-time feedback from your body is crucial. This conscious attention transforms it from a potentially risky habit into mindful self-care. Don't underestimate the importance of reducing friction, especially as skin changes. Water-based lubricants are generally a safe choice. Experiment to find what feels comfortable and safe for your body now, not what worked 20 years ago. Gentleness is key. Protect your skin and tissues. Feeling relaxed and secure is important for both physical and mental comfort. Stress or anxiety can create physical tension. Ensure privacy and minimize distractions. This allows you to focus on mindful awareness. Remember, masturbation is just one small facet of sexual and overall health. It cannot replace partner intimacy. If you have a partner, open communication, affection, and shared intimacy are vital. Overall physical health, regular exercise for circulation and stamina, a balanced diet for nutrients and energy, and adequate sleep are foundational. Medical checkups address underlying conditions, heart health, diabetes, etc., that impact sexual function. Discuss concerns with your doctor. Social connection. Combating loneliness through friends, family, or community involvement is crucial for mental well-being. We've journeyed through the myths, the potential benefits, and the crucial cautions surrounding masturbation for older men. The core message isn't simply that it's okay, but that approaching it with awareness and knowledge is essential for it to be a truly healthy part of your life. Ignorance, outdated beliefs, or simply continuing unchanged habits without considering your aging body, these are the real risks. Just as you wouldn't blindly take supplements without understanding their potential impact, you shouldn't approach this intimate aspect of your life without informed consideration. Listen to your body. Be gentle. Prioritize comfort and safety over frequency or intensity. Integrate this understanding into a broader picture of health that includes diet, exercise, social connection, and open communication with partners and healthcare providers. Your health journey is unique. Taking control involves seeking accurate information and making conscious choices. If this discussion has shed light on something new or clarified a doubt, please consider giving this video a thumbs up and sharing it. Let's help replace silence and stigma with informed conversation. And importantly, reflect on what we've discussed. What is one insight or adjustment you plan to consider in your own approach to health and well-being after hearing this? Share your takeaway in the comments below. Let's learn from each other and support a community focused on vital, informed living. Don't forget to subscribe and click the notification bell for more content dedicated to navigating health wisely as you age. Thank you for watching. Stay informed, stay proactive, and here's to your continued health and vitality.